Rising COVID-19 cases, which states are hit hardest this summer? As we dive into the summer of 2025, a concerning trend is emerging. COVID-19 cases are on the rise in several states across the United States, according to the latest data from the Centers for Disease Control and Prevention, CDC. This summer surge is not just a minor blip, it reflects a significant increase in infections that could impact many individuals, especially the most vulnerable among us. The CDC's recent report indicates that at least 26 states, along with Washington, D.C., are experiencing a rise in COVID-19 cases. Alarmingly, emergency room visits related to COVID-19 for young children have reached their highest levels since March. This data underscores the importance of remaining vigilant during the warmer months, a time when many might let their guard down. Dr. John Lopuk, CBS News chief medical correspondent, shared insights on CBS Mornings, explaining that the seasonal patterns of COVID-19 are becoming clearer. "We now recognize that there are spikes in cases during both winter and summer," he noted. The encouraging news is that, over the years, the number of deaths and hospitalizations has been gradually decreasing each season. However, Dr. Lopuk cautioned against complacency. He emphasized that the rising numbers should not be overlooked, particularly for those at higher risk. The vulnerable populations, including very young children under 4, the elderly, and individuals with compromised immune systems, there are millions of such individuals, are at a greater risk of severe illness, he stated. ###New COVID variants, Nimbus and Stratus. In addition to the rising case numbers, 2 new COVID variants have emerged, dubbed Nimbus and Stratus. Dr. Lopuk reassured the public that these variants are no more deadly than their predecessors. Previous variants, such as NB.1.8.1, also did not lead to more severe illness compared to earlier strains. Symptoms remain consistent, including respiratory issues like cough and sore throat, as well as systemic symptoms such as fever and fatigue. The vaccines developed for this season are effective against the current variants, which is a positive development, Dr. Lopuk remarked. He urged the public to remain cautious, stating, "It's summer, and while people are engaging in various activities, it's crucial to stay alert and take necessary precautions." Should you get a COVID vaccine booster? The CDC continues to advocate for COVID-19 vaccinations, highlighting their role in protecting individuals from severe illness, hospitalization, and death. However, there have been some shifts in the recommendations that have created a bit of confusion. Dr. Lopuk pointed out that the CDC's guidelines differ from those of several major health organizations. For instance, the American College of Obstetricians and Gynecologists recommends that pregnant individuals receive the vaccine. Dr. Lopuk explained, "The baby relies on the mother's immunity for protection before they can receive their own vaccinations. The antibodies from the mother pass through the placenta, providing some level of defense for the baby." Health and Human Services Secretary Robert F. Kennedy Jr. has introduced the concept of shared decision-making regarding vaccinations. This means that individuals should consult with their healthcare providers to make informed choices about vaccination, rather than simply following a blanket recommendation to get vaccinated. The CDC now also suggests a similar approach for administering the COVID-19 vaccine to healthy children. While the agency recommends that most adults aged 18 and older receive the COVID-19 vaccine for the 2024 to 2025 season, it emphasizes the importance of vaccination for those aged 65 and older, those at high risk for severe COVID-19, and individuals who have never received a COVID-19 shot. ###Where are COVID-19 cases rising? According to the CDC, COVID-19 cases are currently increasing in the following states: Arkansas, Hawaii, Illinois, Iowa, Kentucky, North Carolina, Ohio, Pennsylvania, Texas, Virginia. ###Where are COVID-19 cases likely growing? The CDC also indicates that COVID-19 cases are likely on the rise in these areas: Alaska, California, Delaware, District of Columbia, Georgia, Indiana, Maine, Maryland, Massachusetts, Michigan, Mississippi, New Jersey, New York, Oklahoma, South Carolina, Tennessee, Wisconsin. As we navigate this ongoing pandemic, it's essential to stay informed and proactive. What are your thoughts on the current rise in COVID-19 cases? Do you believe the public is taking the necessary precautions, or is there a sense of complacency? Share your opinions in the comments below. Summer COVID surge in Tri-State, wastewater data and prevention tips. The resurgence of COVID-19 during the summer seems to be centered in the Tri-State region, northern Kentucky, southeast Indiana, and southwest Ohio. But here's where it gets interesting. Preliminary data from wastewater samples suggests a notable uptick in viral presence, according to Philip Graham, who manages informatics and surveillance at Northern Kentucky Health. Wastewater monitoring is like a crystal ball for public health, Graham explains. It can alert us to increases in virus circulation even before people start seeking medical attention. In Kentucky, our case counts are climbing, as shown in the state's dashboard, https://kentuckygov/view/dph_KYWSS_score_dashboard/wastewater/VRUSDA-tetrasic-RCOVID%OMBED=y. Gestri direct from VI's portal =y. While there haven't been many hospital admissions or doctor visits yet, health officials anticipate this trend to shift soon. And this is the part most people miss: seasonal patterns play a significant role. Typically, vaccine boosters are given around winter, so immunity might be waning by summer. Plus, the relatively mild winter we experienced could mean it's been years since many people were exposed to the virus, making their immune response less robust. Graham emphasizes that the advice for preventing infection remains unchanged. Getting a COVID booster is still a great idea, especially if you skipped the last one. Staying home when you're sick is crucial. We don't want to spread the virus. When you venture out, wearing masks in crowded areas or while traveling can offer extra protection. In southwest Ohio, the Ohio Department of Health reports that one wastewater treatment facility in the Dayton area is showing moderate and increasing virus levels. https://data.ohio.gov/wps/portal/gov/data/view/ohio-wastewater-monitoring-data. The rest are either stable at low levels or declining. Southeast Indiana's situation is similar, with 3 wastewater sites participating in surveillance efforts, though only one is currently active. This site is showing low but rising virus levels. https://www.coronavirus.in.gov/indiana-covid-19-dashboard-and-map/wastewater-dashboard. This resurgence raises some questions. How will this impact the broader community? Will other regions follow suit? As we navigate these changes, it's important to stay informed and take preventive measures. What do you think? Do you plan to get a booster? Or are you taking other steps to protect yourself? COVID cases rising summer 2024. Do you need a new vaccine? As summer unfolds, COVID cases are on the rise across the United States, prompting a crucial question: is it time to consider getting vaccinated again? With the increase in COVID cases this summer, many individuals are left pondering their personal risk levels and whether they should seek another vaccine dose. As of July 15, the Centers for Disease Control and Prevention (CDC) reported that COVID cases were either increasing or likely increasing in 27 states, including Texas, Illinois, Kentucky, Virginia, and Ohio. In recent weeks, the CDC has also noted a rise in the percentage of positive COVID tests, particularly in the southern regions of the country. The current dominant variant, N.B.1.8.1, is responsible for 43% of all new COVID cases in the U.S. This variant is a descendant of the XBD.1.5.1 strain, which itself is a lineage of the Omicron variant. Earlier this year, N.B.1.8.1 was linked to a spike in hospitalizations in China. This variant has been informally dubbed razorblade throat due to anecdotal reports of individuals experiencing particularly painful sore throats. Dr. William Schaffner, an infectious disease expert at Vanderbilt University Medical Center in Nashville, Tennessee, pointed out that sore throats have been a common symptom of COVID since the onset of the pandemic. He expressed skepticism about any significant changes in the clinical spectrum of COVID, stating, "I doubt the clinical spectrum of COVID has changed substantially." Should I get a COVID booster? When will new vaccines be available? The recent surge in cases coincides with the fact that many Americans may not have received a COVID vaccine in over a year. In May, the Food and Drug Administration (FDA) requested that vaccine manufacturers update their COVID vaccines to target the LP.8.1 strain, which is another offshoot of Omicron that began spreading widely in 2023 and currently accounts for 31% of new cases, according to the CDC. However, these updated vaccines are not expected to be available until the fall and will likely be approved only for adults aged 65 and older, as well as children and adults with at least one underlying health condition that increases their risk of severe illness. For healthy children and adults wishing to receive a vaccine, they may need to seek out older versions or pay out of pocket, with a single dose potentially costing as much as $140. Despite the rising cases, experts believe that population immunity, whether from vaccinations, previous infections, or a combination of both, may provide a buffer for many individuals at this time. Andy Peacock, an infectious disease researcher at Johns Hopkins University, noted, "While we don't have a lot of high level of immunity in the population right now, because it's been so long, we may have enough low-level immunity to just make it a little bit harder for that virus to transmit easily from person to person." Weekly hospitalization rates have remained low, indicating that the new variant may not be causing severe illness. The current number of cases is significantly lower than at this time last year, when the test positivity rate peaked at 17.9% in August. In contrast, the positivity rate for the 2025 season has yet to reach 5%. Peacock explained that it is not uncommon for COVID cases to rise during the summer months, as people tend to congregate indoors to escape the heat. However, he anticipates that any potential summer surge will be relatively minor. The variants have been around for a while and haven't caused any major surges up until now, he said. So again, I'm hopeful that if we see a surge, it'll be a low-level surge compared to previous years. Dr. Ofer Levy, who directs the Precision Vaccines program at Boston Children's Hospital and has advised the FDA, emphasized that individuals at high risk for severe illness should consider getting a COVID shot if they can find one. High-risk groups include older adults, individuals with weakened immune systems, pregnant women, those with underlying health conditions, such as asthma and heart disease. Levy stressed the importance of vaccination for those who have not received a shot in over a year, as their immunity is likely to have diminished. If you're in a high-risk group and you're in a state where cases are rising, you may want to just get the first available appointment and get a shot to protect yourself, he advised. High-risk individuals can then consider receiving an additional COVID shot when the updated vaccines become available in the fall. #COVID typically experiences 2 waves each year. Schaffner noted that individuals in high-risk groups might also want to consider wearing masks during indoor activities, such as going to the movies. Healthy adults and children may have the luxury of waiting longer before seeking another shot, according to Levy. If you're in a lower risk group, that's where things get fuzzy, he remarked. I mean, if you want a vaccine and your healthcare provider concurs and you can get it. Dr. Michael Phillips, an infectious disease specialist at NYU Langone, observed that the majority of positive COVID tests he encounters are among immunocompromised individuals and older adults. He reassured those who have not received a COVID shot in years that they need not be overly concerned at this time. If you're younger, otherwise healthy, I think you're okay, Phillips stated. If you have underlying pulmonary disease, or if you're in an older age group, now is the time to have a conversation with your doctor about whether you should be getting a booster for COVID. He also mentioned that NYU Langone has seen a 40% decrease in positive COVID tests since February. Fatima Amika, a senior analyst at the Center for Outbreak Response Innovation at Johns Hopkins, anticipates that the current wave will peak around September. Schaffner added that another wave can be expected in late fall and winter, stating, COVID has 2 increases each year. Everyone is familiar with the winter increase that goes along with flu and RSV. Conclusion. As we navigate this evolving situation, it's essential to stay informed and proactive about our health. What are your thoughts on the current rise in COVID cases? Do you believe it's time for another vaccine? Share your opinions in the comments below.